Former farm worker Doris Malepe has been a Hlokomela HIV clinic peer counsellor since 2007. When myths around HIV were all too familiar, some even boasted about having multiple sexual partners, and few used condoms.
They believe a lot in witchcraft. For example, I've had to teach them about shingles. It wasn't easy to make them understand the rash they have is shingles. They're not bewitched.
Former nurse Christine du Preez started the Hlokomela HIV clinic 10 years ago after observing scores of deaths from the virus. For her, peer education would be an effective way to reach communities.
There's sex workers, farm workers, there's lots of people part of this. You know, we have almost 56 people that's working for Hlokomela, and then about 101 peer educators. We call them non-peelos. So they're all benefiting, and there's about 12,000 farm workers that's working on the farms each and every season.
Malepe works in one of the 10 satellite clinics, serving over 50 farms in the area. Her job entails working with farm supervisors to identify potential HIV cases and offering support. Routine visits also ensure that those already on treatment stick to it. On average, 3,000 people are treated every month, and more than 1,500 are on the Hlokomela ARV program.
Now people are disclosing. We have ARV clubs, we have support groups, people are activists. They will say, listen, I'm HIV positive, and they talk.
Some 29,000 people have tested for HIV since October as part of a new drive to test 33,000 people by March 2016. But clinic staff say stereotypes are stumbling blocks to the fight against HIV.
We need to give them information strongly, because if you don't do that, they will use it today when they see that they are now okay. Like maybe the patient came being sick, so when she sees herself recovered, she thinks she has healed. Meanwhile, the HIV virus is just under control.
Other key populations affected by HIV in the area are not left out either.
They are supposed to recruit 20 sex workers a month, or they are supposed to reach 20 sex workers a month, educate them on HIV and AIDS, TB, STIs. If they want to go for HIV counseling and testing, they can refer them to any clinic where they feel comfortable to go, or they can come to us.
It's our responsibility to ensure that fellow sex workers are safe. We also teach them not to be tempted by money, especially when a person says, I will give you 1,000 or 1,500 not to use a condom.
1 round, 1 condom.
Now recognized as a best practice hub, the Hlokomela clinics have saved the lives of thousands of farm workers. Hoedspruit, Limpopo.